Throughout this pandemic, mental health challenges and substance abuse have been rising, and it's now time we rise to meet this challenge. Even before COVID, as a candidate for this office, I made clear my highest long-term priority is rebuilding San Diego's behavioral health system, the combination of mental health and drug treatment services. Right now, an underfunded and outdated system just shuffles patients, especially those experiencing homelessness, from one crisis institution to the next without making a lasting difference. Last year, we launched a $25 million behavioral health impact fund designed to jumpstart an expansion of critically needed care. In the coming weeks, I will announce its initial results, and when San Diego sees the impact made, I know there will be demands to do more. We can and must build a network of comprehensive behavioral health care that delivers the right services to the right person at the right time. We must move from crisis care to continuous care. We must integrate behavioral health fully into the actions to reduce homelessness. That's why, in recent weeks, we launched a new approach to the most common and often most dangerous entry point into behavioral health, a call to 911. The vast majority of emergency behavioral health calls law enforcement receives, over 59,000 a year, are about providing medical assistance, not making arrests. The county's new mobile crisis response teams, begun as a pilot program in North County, are replacing cops with clinicians on behavioral health calls. It's already delivering results by de-escalating dangerous situations and providing treatment, not punishment, to people in crisis. I appreciate the work of our district attorney in this effort. Over the coming year, we plan to take this innovative program countywide and fully integrate it into the 911 system. But we must recruit more behavioral health professionals, those in critical need, to make this program and our entire expanded system a success. We face a steep shortage of essential mental health workers. To tackle this challenge, I'll be convening the first of its kind San Diego County Behavioral Health Workforce Conference, bringing together the heads of our major universities and community colleges to bring a new crop of behavioral health professionals to the front lines of this fight, so we make real progress on behavioral health and also create a pipeline for thousands of good-paying careers along the way. But the right response still has to direct people to the right place to get the right care. That's why I fought last year to create the Hillcrest Regional Crisis Hub. Previously an abandoned building planned as a site for more luxury condos, but instead we're building a world-class center for behavioral health recovery. And more hubs like this are on the way to serve every region of our county. And when individuals are ready for discharge, it won't be back onto the streets with no ability to access follow-up care. They will be paired with a care coordinator, someone to help them navigate housing, access services, and be a source of ongoing stability and support that they can count on. That's just a part of our larger effort to break the cycle of poverty, addiction, disease, and incarceration. The county board just voted to abandon the long-failed war on drugs and embrace harm reduction to address substance abuse, a 180-degree shift from the past. We launched our Accelerated Connections to Treatment program to bring vital drug treatment into our mental health hospital. And the next week, we will be issuing a standing order from Dr. Wilma Wooten enabling community-based naloxone to prevent opioid overdose, with medication paid for by the state and distributed peer-to-peer, all through a county clearinghouse. But we know supportive housing goes hand in hand with effective drug treatment. And in the coming months, I will unveil a proposal and location to make significant progress on both. No doubt we will face opposition. But we can no longer let the "not in my backyard" naysayers prolong suffering on our streets and our neighborhoods. And all of these efforts will help reduce homelessness. But the creation of a new county Department of Homeless Solutions and Equitable Communities is critical to streamlining our regional response. This office will allow us to work more closely with local cities, in particular a renewed effort with Mayor Todd Gloria on maximizing available state and federal resources. People are hurting, Neighborhoods are suffering, and we have to do better.